Anatomy of upper limb. Introduction. The arm extends from the shoulder joint till the elbow joint. The skeleton of the arm is a solo bone, the humerus. Medial and lateral intermuscular septa divide the arm into an anterior or flexor compartment and a posterior or extensor compartment, to give each compartment its individuality and freedom of action. Since the structures in the front of arm continue across the elbow joint into the cubital fossa, the cubital fossa is also included in this chapter. The arm is called brachium, so most of the structures in this chapter are named accordingly, like brachialis, Coracobrachialis and brachial artery. The following landmarks can be felt in the living subject. L. The greater tubercle of the humerus is the most lateral bony point in the shoulder region. It can be felt just below the acromion, deep to the deltoid when the arm is by the side of the trunk. 2. The shaft of the humerus is felt only indistinctly because it is surrounded by muscles in its upper half. In the lower half, the humerus is covered anteriorly by the biceps brachii and brachialis, and posteriorly by the triceps brachii. 3. The medial epicondyle of the humerus is a prominent bony projection on the medial side of the elbow. It is best seen and felt in a mid-flexed elbow. 4. The lateral epicondyle of the humerus is less prominent than the medial. It can be felt in the upper part of the depression on the posterolateral aspect of the elbow in the extended position of the forearm. 5. The medial and lateral supracondylar ridges are better defined in the lower portions of the medial and lateral borders of the humerus. They can be felt in the lower 1/4 of the arm as upward continuations of the epicondyles. 6. The deltoid forms the rounded contour of the shoulder. The apex of the muscle is attached to the deltoid tuberosity located at the middle of the anterolateral surface of the humerus. 7. The coracobrachialis forms an inconspicuous rounded ridge in the upper part of the medial side of the arm. Pulsations of the brachial artery can be felt in the depression behind it. The biceps brachii muscle is overlapped above by the pectoralis major and by the deltoid. Below these muscles the biceps forms a conspicuous elevation on the front of the arm. Upon flexing the elbow, the contracting muscle becomes still more prominent. The tendon of the biceps can be felt in front of the elbow. The tendon is a guide to the brachial artery which lies on its medial side. 8. The brachial artery can be felt in front of the elbow joint just medial to the tendon of the biceps brachii. Brachial pulsations are used for recording the blood pressure. 9. The ulnar nerve can be rolled by the palpating finger behind the medial epicondyle of the humerus. During leprosy this nerve becomes thick and enlarged. 10. The superficial cubital veins can be made more prominent by applying tight pressure round the arm and then contracting the forearm muscles by clenching and releasing the fist a few times. The cephalic vein runs upwards along the lateral border of the biceps. The basilic vein can be seen along the lower half of the medial border of the biceps. The cephalic and basilic veins are connected together in front of the elbow by the median cubital vein which runs obliquely upwards and medially. Compartments of the arm. The arm is divided into anterior and posterior compartments by extension of deep fascia which are called the medial and lateral intermuscular septa, Fig. 8.2. These septa provide additional surface for the attachment of muscles. They also form planes along which nerves and blood vessels travel. The septa are well defined only in the lower half of the arm and are attached to the medial and lateral borders and supracondylar ridges of the humerus. The medial septum is pierced by the ulnar nerve and the superior ulnar collateral artery. The lateral septum is pierced by the radial nerve and the anterior descending branch of the profunda brachii artery. 2 additional septa are present in the anterior compartment of the arm. The transverse septum separates the biceps from the brachialis and encloses the musculocutaneous nerve. The anteroposterior septum separates the brachialis from the muscles attached to the lateral supracondylar ridge. It encloses the radial nerve and the anterior descending branch of the profunda brachii artery. Anterior compartment. Dissection. Make an incision in the middle of deep fascia of the upper arm right down up to the elbow joint. Reflect the flaps sideways. The most prominent muscle seen is the biceps brachii. Deep to this, another muscle called brachialis is seen easily. In the facial septum between the two muscles lies the musculocutaneous nerve, a branch of the lateral cord of brachial plexus. Trace the tendinous long head of biceps arising from the supraglenoid tubercle and the short head arising from the tip of the coracoid process of scapula. Identify coracobrachialis muscle on the medial side of biceps brachii. This muscle is easily identified as it is pierced by musculocutaneous nerve. Clean the branches of the nerve supplying all the three muscles dissected. Muscles. Muscles of the anterior compartment of the arm are the coracobrachialis, the biceps brachii and the brachialis. They are described in tables 8.1 and 8.2. Changes at Phi level of insertion of coracobrachialis: 1. Bone vesicular shaft become triangular below this level. 2. Facial septa, the medial and lateral intramuscular septa become better defined from this level down. 3. 2 Mucicals, deltoid and coracobrachialis are inserted at this level. Upper end of origin of brachialis. Upper end of origin of the medial head of triceps brachii. 2. Arteries, the brachial artery passes from the medial side of the arm to its anterior aspect. The profunda brachii artery runs in the spiral groove and divides into its anterior descending/radial collateral artery and posterior descending/middle collateral branches. The superior ulnar collateral artery originates from the brachial artery, and pierces the medial intermuscular septum along with the ulnar nerve. The nutrient artery of the humerus enters the bone. Veins. I. The basilica vein pierces the deep fascia. 2 Veni comitants of the brachial artery may unite to form one brachial vein. Nerves. The median nerve crosses the brachial artery from the lateral to the medial side. The ulnar nerve pierces the medial intermuscular septum with the superior ulnar collateral artery and goes to the posterior compartment. The radial nerve pierces the lateral intermuscular septum with the anterior descending, radial collateral, branch of the profunda brachii artery and passes from the posterior to the anterior compartment. The medial cutaneous nerve of the arm pierces the deep fascia. The medial cutaneous nerve of the forearm pierces the deep fascia. Morphological importance of coracobrachialis. Morphologically, the muscle is very important for following reasons. Morphologically, the coracobrachialis represents the medial compartment, which is so well developed in the thigh. In some animals it is a tricipital muscle. In man the upper two heads have fused and musculocutaneous nerve passes between the two, and the lowest third head has disappeared. Persistence of the lower head in man is associated with the presence of ligament of Struthers, which is a fibrous band extending from the trochlear spine to the medial epicondyle of the humerus, to which the third head of the coracobrachialis is inserted, and from the lower part of which the Pronator teres muscle takes origin. Beneath the ligament pass the median nerve or brachial artery or both. The front or anterior compartment of the arm is homologous with flexor and medial compartments of the thigh. The flexor compartments of thigh lies posteriorly because the lower limb bud rotates medially. Musculocutaneous nerve. The musculocutaneous nerve is the main nerve of the front of the arm, and continues below the elbow as the lateral cutaneous nerve of the forearm, see Fig 7.1. It is a branch of the lateral cord of the brachial plexus, arising at the lower border of the pectoralis minor, see Fig 4.14, in the axilla. Root value. The root value of musculocutaneous nerve is ventral rami of C5-C7 segments of spinal cord. Origin, course, and termination. Musculocutaneous nerve arises from the lateral cord of brachial plexus in the lower part of the axilla. It accompanies the third part of the axillary artery. It then enters the front of arm, where it pierces coracobrachialis muscle. Then it runs downwards and laterally between biceps brachii and brachialis muscles to reach the lateral side of the tendon of biceps brachii. It terminates by continuing as the lateral cutaneous nerve of forearm 2 cm above the bend of the elbow. Relations. In left lower part of the axilla, it accompanies the third part of the axillary artery and has the following relations. Anteriorly, pectoralis major. Posteriorly, subscapularis. Medially, axillary artery and lateral root of the median nerve. Laterally, coracobrachialis. Musculocutaneous nerve leaves the axilla, and enters the front of the arm by piercing the coracobrachialis, Fig 8.6. In the arm, it runs downward and laterally between the biceps brachii and brachialis to reach the lateral side of the tendon of the biceps. It ends by piercing the fascia 2 cm above the bend of the forearm. Branches and distribution. Muscular, it supplies the following muscles of the front of the arm. I. Biceps brachii, long head and short head. 2. Brachialis. Coracobrachialis cutaneous. Through the lateral cutaneous nerve of the forearm it supplies the skin of the lateral side of the forearm from the elbow to the wrist including the ball of the thumb, see Fig 7.1. Articular branches, the elbow joint through its branch to the brachialis. The shoulder joint through a separate branch which enters the humerus along with its nutrient artery. Communicating branches, the musculocutaneous nerve through lateral cutaneous nerve of forearm communicates with the neighboring nerve, namely the superficial branch of the radial nerve, the posterior cutaneous nerve of the forearm, and the ulnar cutaneous branch of the median nerve. Clinical anatomy. Physician holds the patient's wrist firmly, not letting it move. Patient is requested to flex the elbow against the resistance offered by physician's hand. One can see and palpate hardening biceps and brachialis muscles, Fig 8.8. Features. Brachial artery is the continuation of the axillary artery. It extends from the lower border of the teres major muscle to a point in front of the elbow, at the level of the neck of the radius, just medial to the tendon of the biceps brachii. Beginning, course and termination. Brachial artery begins at the lower border of teres major muscle as continuation of axillary artery. It runs downwards and laterally in the front of arm and crosses the elbow joint. It ends at the level of the neck of radius in the cubital fossa by dividing into its two terminal branches, the radial and ulnar arteries. Relations. 1. It runs downwards and laterally, from the medial side of the arm to the front of the elbow. 2. It is superficial throughout its extent and is accompanied by two veni comitants. 3. Anteriorly, in the middle of the arm it is crossed by the median nerve from the lateral to the medial side, and in front of the elbow it is covered by the bicipital aponeurosis and the median cubital vein, Fig 8.9. 4. Posteriorly, it is related to the triceps brachii, the radial nerve and the profunda brachii artery. 5. Medially, in the upper part it is related to the ulnar nerve and the basilic vein, and in the lower part to the median nerve, Fig 8.9. 6. Laterally, it is related to the coracobrachialis, the biceps brachii and the median nerve in its upper part, and to the tendon of the biceps brachii at the elbow. 7. At the elbow, the structures from the medial to the lateral side are, median nerve, brachial artery, biceps brachii tendon, radial nerve on a deeper plane, MBBR. Branches. 1. Muscular branches. 2. The profunda brachii artery arises just below the teres major and accompanies the radial nerve. 3. The superior ulnar collateral branch arises in the upper part of the arm and accompanies the ulnar nerve, Fig 8.10. 4. A nutrient artery is given off to the humerus. 5. The inferior ulnar collateral, or supratrochlear, branch arises in the lower part and takes part in the anastomosis around the elbow joint. 6. The artery ends by dividing into two terminal branches, the radial and FL/Nor arteries. Anastomosis around the elbow joint. Anastomosis around the elbow joint links the brachial artery with the upper ends of the radial and ulnar arteries. It supplies the ligaments and bones of the joint. The anastomosis can be subdivided into the following parts. In front of the lateral epicondyle of the humerus, the anterior descending, radial collateral, branch of the profunda brachii anastomosis with the radial recurrent branch of the radial artery. Behind the lateral epicondyli of the humerus, the posterior descending branch of the profunda brachii artery anastomosis with the interosseous recurrent branch of the posterior interosseous artery. In front of the medial epicondyle of the humerus, the inferior ulnar collateral branch of the brachial artery, anastomosis with the anterior ulnar recurrent branch of the ulnar artery. Behind the medial epicondyle of the humerus, the superior ulnar collateral branch of the brachial artery anastomosis with the posterior ulnar recurrent branch of the ulnar artery. Brachial pulsations are felt or auscultated in front of the elbow just medial to the tendon of biceps for recording the blood pressure, Fig 8.11. Figure. Although the brachial artery can be compressed anywhere along its course, it can be compressed most favorably in the middle of the arm, where it lies on the tendon of the coracobrachialis. Brachial pulsations are felt or auscultated in front of the elbow just medial to the tendon of biceps for recording the blood pressure, Fig 8.11. Although the brachial artery can be compressed anywhere along its course, it can be compressed most favorably in the middle of the arm, where it lies on the tendon of the coracobrachialis large nerves. Median nerve. Median nerve is closely related to the brachial artery throughout its course in the arm, Fig 8.9. In the upper part, it is lateral to the artery. In the middle of the arm, it crosses the artery from lateral to the medial side, and remains on the medial side of the artery right up to the elbow. Sphygmomanometer covered rubber cuff stethoscope on brachial artery. Fig 8.11, blood pressure being taken in the arm. The median nerve gives off a branch to the Pronator arteries just above the elbow and vascular branches to the brachial artery. An articular branch to the elbow joint arises at the elbow. Ulnar nerve. Ulnar nerve runs on the medial side of the brachial artery up to the level of insertion of the coracobrachialis, where it pierces the medial intermuscular septum and enters the posterior compartment of the arm. It is accompanied by the superior ulnar collateral vessels. At the elbow, it passes behind the medial epicondyle where it can be palpated with a finger, Fig 8.13. Radial nerve. At the beginning of the brachial artery, the radial nerve lies posterior to the artery. Soon the nerve leaves the artery by entering the radial, spiral, groove on the back of the arm where it is accompanied by the profunda brachii artery, Fig 8.13. In the lower part of the arm, the nerve appears again on the front of the arm where it lies between the brachialis, medially, and the brachioradialis and extensor carpi radialis longus, laterally. Its branches will be discussed with the back of the arm. Cubital fossa. Dissection. Identify the structures, see text, present in the roof of a shallow cubital fossa located on the front of the elbow. Separate the lateral and medial boundaries formed respectively by the brachioradialis and Pronator arteries muscles. Clean the contents, median nerve on the medial side of brachial artery. Terminal part of brachial artery bifurcating into radial and ulnar arteries. The tendon of biceps brachii muscle between the brachial artery and radial nerve. The radial nerve on a deeper plane on the lateral side of biceps tendon. Identify brachialis and supinator muscles, forming the floor of cubital fossa. Features. Cubital, Latin cubitus, elbow, fossa is a triangular hollow situated on the front of the elbow. It is homologous with the popliteal fossa of the lower limb situated on the back of the knee. Boundaries. Laterally medial border of the brachioradialis, Fig 8.14. Medially lateral border of the Pronator arteries. Base. It is directed upwards, and is represented by an imaginary line joining the front of two epicondyles of the humerus. Apex. It is directed downwards, and is formed by the meeting point of the lateral and medial boundaries separated from the median nerve by the deep head of the Pronator arteries, Fig 8.19. Ulnar artery gives off the anterior ulnar recurrent, the posterior ulnar recurrent, and the common interosseous branches. The common interosseous branch divides into the anterior and posterior interosseous arteries, and latter gives off the interosseous recurrent branch. 1. The tendon of the biceps brachii, with the bicipital aponeurosis, Fig 8.18. 2. The radial nerve, accompanied by the radial collateral artery, appears in the gap between the brachialis, medially, and the brachioradialis and extensor carpi radialis longus laterally, Fig 8.17. While running in the intermuscular gap, radial nerve supplies the three flanking muscles, and just below the level of the lateral epicondyle it gives off the posterior interosseous nerve or deep branch of the radial nerve which leaves the fossa by piercing the supinator muscle, Fig 8.17. The remaining superficial branch runs in the front of forearm for some distance. The cubital region is important for the following reasons. Clinical anatomy. The median cubital vein is often the vein of choice for intravenous injections, see Fig 7.8. The blood pressure is universally recorded by auscultating the brachial artery in front of the elbow, Fig 8.11. The anatomy of the cubital fossa is useful while dealing with the fracture around the elbow, like the supracondylar fracture of the humerus. Posterior compartment. Dissection. Reflect the skin of back of arm to view the triceps brachii muscle. Define its attachments and separate the long head of the muscle from its lateral head. Radial nerve will be seen passing between the long head of triceps and medial border of the humerus. Note the continuity of radial nerve up to axilla. Carefully cut through the lateral head of triceps to expose radial nerve along with profunda brachii vessels. Note that the radial nerve lies in the radial groove, on the back of humerus, while passing between the lateral head of triceps above and its medial head below. In the lower part of arm, the radial nerve lies on the front of elbow just lateral to the brachialis, dividing into two terminal branches in the cubital fossa. The following landmarks can be felt in the living subject. L. The greater tubercle of the humerus is the most lateral bony point in the shoulder region. It can be felt just below the acromion, deep to the deltoid when the arm is by the side of the trunk. 2. The shaft of the humerus is felt only indistinctly because it is surrounded by muscles in its upper half. In the lower half, the humerus is covered anteriorly by the biceps brachii and brachialis, and posteriorly by the triceps brachii. 3. The medial epicondyle of the humerus is a prominent bony projection on the medial side of the elbow. It is best seen and felt in a mid-flexed elbow. 4. The lateral epicondyle of the humerus is less prominent than the medial. It can be felt in the upper part of the depression on the posterolateral aspect of the elbow in the extended position of the forearm. 5. The medial and lateral supracondylar ridges are better defined in the lower portions of the medial and lateral borders of the humerus. They can be felt in 3 muscle, Fig 8.17. The remaining superficial branch runs in the front of forearm for some distance. The cubital region is important for the following reasons. Clinical anatomy. The median cubital vein is often the vein of choice for intravenous injections, see Fig 7.8. Separated from the median nerve by the deep head of the Pronator arteries, Fig 8.19. Ulnar artery gives off the anterior ulnar recurrent, the posterior ulnar recurrent, and the common interosseous branches. The common interosseous branch divides into the anterior and posterior interosseous arteries, and latter gives off the interosseous recurrent branch. 4. The tendon of the biceps brachii, with the bicipital aponeurosis, Fig 8.18. 5. The radial nerve, accompanied by the radial collateral artery, appears in the gap between the brachialis, medially, and the brachioradialis and extensor carpi radialis longus laterally. While running in the intermuscular gap, radial nerve supplies the 3 flanking muscles, and just below the level of the lateral epicondyle it gives off the posterior interosseous nerve or deep branch of the radial nerve which leaves the fossa by piercing the supinator muscle. The remaining superficial branch runs in the front of forearm for some distance. Blood pressure is universally recorded by auscultating the brachial artery in front of the elbow, Fig 8.11. The anatomy of the cubital fossa is useful while dealing with the fracture around the elbow, like the supracondylar fracture of the humerus. Posterior compartment. Dissection. Reflect the skin of back of arm to view the triceps brachii muscle. Define its attachments and separate the long head of the muscle from its lateral head. Radial nerve will be seen passing between the long head of triceps and medial border of the humerus. Note the continuity of radial nerve up to axilla. Carefully cut through the lateral head of triceps to expose radial nerve along with profunda brachii vessels. Note that the radial nerve lies in the radial groove, on the back of humerus, while passing between the lateral head of triceps above and its medial head below. In the lower part of arm, the radial nerve lies on the front of elbow just lateral to the brachialis, dividing into two terminal branches in the cubital fossa. The ulnar nerve, which was seen in the anterior compartment of arm till its middle, pierces the medial intermuscular septum with its accompanying vessels, reaches the back of elbow and may easily be palpated on the back of medial epicondyle of humerus. Features: the region contains the triceps muscle, the radial nerve and the profunda brachii artery. The nerve and artery run through the muscle. The ulnar nerve runs through the lower part of this compartment. Triceps brachii muscle. Origin: triceps brachii muscle arises by the following three heads. The long head arises from the infraglenoid tubercle of the scapula. It is the longest of the three heads. The lateral head arises from an oblique ridge on the upper part of the posterior surface of the humerus, corresponding to the lateral lip of the radial, spiral, groove. 3. The medial head arises from a large triangular area on the posterior surface of the humerus below the radial groove, as well as from the medial and lateral intermuscular septa. At the level of the radial groove, the medial head is medial to the lateral head. Insertion: the long and lateral heads converge and fuse to form a superficial flattened tendon which covers the medial head and are inserted into the posterior part of the superior surface of the olecranon process. The medial head is inserted partly into the superficial tendon, and partly into the olecranon. Although the medial head is separated from the capsule of the elbow joint by a small bursa, a few of its fibers are inserted into this part of the capsule. This prevents nipping of the capsule during extension of the arm. These fibers are referred to as the orticularis cubiti, or as the subcutaneous nerve supply. Each head receives a separate branch from the radial nerve, C7, C8. The branches arise in the axilla and in the radial groove. In radial nerve injuries in the arm, the triceps brachii usually escapes complete paralysis because the two nerves supplying it arise in the axilla. Physician holds the flexed forearm firmly. Patient is requested to extend his elbow against the resistance of the physician's hand. The contracting triceps brachii is felt. Actions: the triceps is a powerful active extensor of the elbow. The long head supports the head of the humerus in the abducted position of the arm. Gravity extends the elbow passively. Electromyography has shown that the medial head of the triceps is active in all forms of extension, and the actions of the long and lateral heads are minimal, except when acting against resistance. Radial nerve or musculospiral nerve. Radial nerve is the largest branch of the posterior cord of the brachial plexus with a root value of C5-C8, T1. Origin, course, and termination. Radial nerve is given off from the posterior cord in the lower part of axilla. 1. It runs behind third part of axillary artery. 2. In the arm it lies behind the brachial artery. 1. Leaves the brachial artery to enter the lower triangular space to reach the oblique radial sulcus on the back of humerus. 2. The nerve reaches the lateral side of arm 5 cm below deltoid tuberosity, pierces lateral intermuscular septum to enter the anterior compartment of arm on its lateral aspect. 3. It descends down across the lateral epicondyle into cubital fossa. Radial nerve terminates by dividing into a superficial and a deep branch just below the level of lateral epicondyle. These are seen in the cubital fossa. Relations: in the lower part of the axilla, radial nerve passes downwards and has the following relations. Anteriorly, third part of the axillary artery. Posteriorly, subscapularis, latissimus dorsi and teres major. Laterally, axillary nerve and coracobrachialis. Medially, axillary vein, see Fig 4.9. In the upper part of the arm, it continues behind the brachial artery, and passes posterolaterally, with the profunda brachii vessels, through the lower triangular space, below the teres major, and between the long head of the triceps brachii and the humerus. It then enters the radial groove with the profunda vessels. In the radial groove, the nerve runs downwards and laterally between the lateral and medial heads of the triceps brachii, in contact with the humerus, Fig 8.13. At the lower end of the groove, 5 cm below the deltoid tuberosity, the nerve pierces the lateral intermuscular septum and passes into the anterior compartment of the arm, Fig 8.23, to reach the cubital fossa where it ends by dividing into superficial and deep branches. Branches and distribution. Various branches of radial nerve are shown in Fig 8.23. Muscular. 1. Before entering the spiral groove, radial nerve supplies the long and medial heads of the triceps brachii. 2. In the spiral groove, it supplies the lateral and medial heads of the triceps brachii and the anconeus. 3. Below the radial groove, on the front of the arm, it supplies the brachialis with proprioceptive fibers. The brachioradialis and extensor carpi radialis longus are supplied with motor fibers. Cutaneous branches. 1. In the axilla, radial nerve gives off the posterior cutaneous nerve of the arm which supplies the skin on the back of the arm. 2. In the radial groove, the radial nerve gives off the lower lateral cutaneous nerves of the arm and the posterior cutaneous nerve of the forearm. Articular branches. The articular branches near the elbow supply the elbow joint. The radial nerve is very commonly damaged in the region 01, the radial, spiral, groove. The common causes of injury are as follows. Sleeping in an armchair with the limb hanging by the side of the chair, Saturday night palsy, or even the pressures of the crutch paralysis. Fractures of the shaft of the humerus. This results in the weakness and loss of power of extension at the wrist drop. And sensory loss over a narrow strip on the back of forearm, and on the lateral side 01, the dorsum of the hand. Wrist drop is quite disabling, because the patient cannot grip any object firmly in the hand without the synergistic action of the extensors. 3. Profunda brachii artery. 9. Profunda brachii artery is a large branch, arising just below the teres major. It accompanies the radial nerve through the radial groove, and before piercing the lateral intermuscular septum, it divides into the anterior and posterior descending branches which take part in the anastomosis around the elbow joint, Fig 8.10. Branches. 1. The radial collateral, anterior descending, artery is one of the terminal branches, and represents the continuation of the profunda artery. It accompanies the radial nerve, and ends by anastomosing with the radial recurrent artery in front of the lateral epicondyle of the humerus, Fig 8.21. 2. The middle collateral, posterior descending, artery is the largest terminal branch, which descends in the substance of the medial head of the triceps. It ends by anastomosing with the interosseous recurrent artery, behind the lateral epicondyle of the humerus. It usually gives a branch which accompanies the nerve to the anconeus. 3. The deltoid, descending, branch ascends between the long and lateral heads of the triceps, and anastomoses with the descending branch of the posterior circumflex humeral artery. 4. The nutrient artery to the humerus is often present. It enters the bone in the radial groove just behind the deltoid tuberosity. However, it may be remembered that the main artery to the humerus is a branch of the brachial artery. Mnemonics. Cubital fossa contents my bottoms rarnd red or MBBR from medial to lateral. /V/Edian nerve. Brachial artery tendon of biceps radial nerve radial nerve muscles supplied, simplified, Ters brachioradialis extensors of wrists supinator triceps brachii. Biceps brachii origins. You look shorter to a street co. Short head originates from coracoid process. Long head originates from the supraglenoid tubercle. Medial root of median nerve crosses the axillary artery in front to join lateral root to form the median nerve. Median nerve, brachial artery, tendon of biceps brachii and radial nerve is the order of structures from medial to lateral side in the cubital fossa. Triceps brachii is the only active extensor of elbow joint. Gravity extends the joint passively. Biceps brachii is a strong supinator of the flexed elbow, besides being its flexor. 4.